Hello everyone, myself Ruchi Patel, working as an assistant professor at LJ College of Physiotherapy. Today I am going to take third year topic, that is special test, and we are going to discuss about the special test related to the sacroiliac joint. So let's start with the presentation. As we all know, here you all can see that we have sacroiliac joint on the both the side, and it is formed by the articulating surfaces of the sacrum, and which gets articulates with the ilium, or we can say which get articulates with the pelvic bone. So sacroiliac joint, it is also called as the SI joint, and it is the joint which is formed between the sacrum and the ilium bone of the pelvis, and which are connected by the strong ligaments. In human, the sacrum supports the spine and is supported in turn by an ilium on the each side. The joint is strong, supportive the entire weight of the upper body. So, in many cases, we find the SI joint pain, and it's a very frequent the inflammatory type of joint. So, we get many patients of SI joint dysfunction. So, how we'll get to know for the SI joint dysfunction, whether it is in the SI joint, whether it is a lumbar joint involvement, whether it is a nerve root compression. So, to identify this, along with the history, along with the examination, we require the special test to rule out the condition. So we have different tests. Here we have divided into the neurological involvement. To know about the neurological involvement, we have prone action SLR test, then we have straight leg raise test, then supine active straight leg raise test. Then to check for the sacroiliac joint involvement, we can perform the Flamingo test, we can perform the Genslen's test, we can perform the Patrick test. Okay. Then for the limb length discrepancy, or if there is involvement of the any apparent or true length discrepancy, and because of that, if the person is getting the pain in the SI joint, then we can do with the limb length measurement, and we can rule out it. Then for the muscle dysfunction, we can do Patrick test, we can do Treadlenburg test, and 1990 straight leg raise test. So here I have included a few tests which is related to the SI joint dysfunction. In the exam, this question can be asked for the 5 marks, and you have to mention the special test along with the their findings, what all findings you can get, and if possible, then you can draw a diagram. Okay, so first is the straight leg raise test. It is also called as Lasik test. So in this test, what we have to do, we just have to make the patient to lie down in the supine position. Then uh, here the therapist will lift the patient leg. First, the therapist will check on the normal side, and then just we have to compare it with the other side. And if there is any difference, so we can consider as a positive test. Okay, so whenever we check for the any special test, we just have to focus on the findings, and what all findings we are getting in the patient, that also matter. Because if we are asking that like if we are doing the straight leg raising test, and if the patient is complaining of the pain in the back, then it is not related to the your SI joint, right? So we have to ask the patient just to show the site where exact the patient is getting pain when we are performing this special test. Okay, so in this test, will therapist will passively take the leg around 70 degree. If the pain is getting started after 70 degree in the SI joint, then it indicates the positive test. In another way, we can do bilateral straight leg raising. So here the therapist will lift both the legs together and will ask for the symptoms, whether it is a positive or negative. Then we have supine active straight leg raise test. In this, we have three parts. In the first, we'll ask the patient to do the straight leg raising. If the patient is getting pain at the same place, then of course will not proceed for the further. But if the patient is saying he or she is comfortable, then we'll proceed for the second part. If the patient is lifting the leg and there is an issue of imbalance, then the therapist will give compression to the pelvis from the both the side. And if the patient is saying that he or she is comfortable now, then uh, we can consider as a involvement of the SI joint. Then in the third part, what we'll do, uh, we'll ask the patient to lift the leg. Okay, so straight leg raising will ask the patient to do. Along with that, on the opposite side, for the uh, shoulder level and for the trunk rotational motion, the therapist will resist for the motion. Here in this figure, you all can see that therapist is giving resistance from the for the right side. So patient is trying to rotate the body towards the left side, and therapist is giving resistance, and along with that the patient is lifting the left leg. Okay, so if the patient is having any issues, or if the patient is complaining of any pain or any other complaint, then the test is positive. Okay, then we have prone active straight leg raise test. So in this, the patient should be in the prone position, same like the active straight leg raising. Here the patient will lift actively the leg lift, or actively the leg raising procedure. And in the second phase, the again therapist will give compression or stabilization from the both the side, and then the therapist will ask the patient to lift the leg. If patient is, after giving this compression, if the patient is performing this uh, prone straight leg raising in a very comfort level, then that suggests that there is a involvement, or there is a instability in the pelvic region. Then in the third part, again, uh, with the therapist will ask the patient to lift the leg, and on the opposite side, for the shoulder extension movement, therapist will give resistance. So both the movements together the patient has to perform, and the therapist will check for the findings, whether the patient is able to perform, or whether the patient is uncomfortable, or whether the patient is getting any pain or any other complaint. So based on that, the therapist can decide. Okay, so next test which we have, that is the Patrick test. This test, it is also called as the figure of four test. In this test, or we can consider as a Faber's test. Okay, so you can write as a Faber's test, Patrick test, and sometimes the examiner can ask like the figure of four test. Okay, so in this, the patient should be in the supine position, and therapist, again, for the all the special tests, both the sides should be checked. Okay, or both the sides should be compared. So again, in this test, the patient should be in the supine position. The leg in which the examiner is checking, that leg should be in the 90 degree of flex position, and the leg should be kept just above to the knee of the opposite side. So in this image, you all can, in this figure you all can see. Okay, so now after this red arrow is indicating that the therapist is giving the downward pressure and trying to take this knee or the leg in the downward direction towards the plinth. Okay, and if the patient and the other with the other end, therapist gives stabilization to the opposite ASIS area. So if the patient is complaining of the pain in the SI joint during doing this test, then that test is positive. Okay, then we have Yeoman's test. For the Yeoman's test, patient should be in the prone position. Hip and knee should be in the 90 degree of flexion position, and the therapist will try to take this leg just away from the plinth. If the patient complains of pain in the SI joint, then this test is positive. Then we have Genslin's test. For this test, mainly we perform in the sideline position. The therapist can also ask the patient to perform this test in the supine position if the patient is unable to go for the sideline position. Okay, so in this test, the patient should be in the sideline position. Therapist will ask the patient to flex the opposite leg and try to take that knee towards the chest. Okay, and with the other side, the therapist will check how he or she will check. She'll keep one hand just near to the underneath to the knee and one hand for the stabilization of the pelvis, and then she will try to take in the extended and abducted position. If the patient complains of pain, then that is the positive. So here hyperextension movement should be done to check for the SI joint dysfunction. The same test should be done in the supine position. The patient should come at the edge of the plinth, or the one leg, that is the tested leg, should be in the downward direction. That should go for the hyperextended position. Opposite knee should be taken towards the chest. And the same symptoms if patient is complaining, then the test is positive. Then we have Flamingo test. For this test, the patient should be in the standing position, and here the patient has to stand on the one leg. Okay, so during this test, along with the torsion, that is anterior and posterior torsion motion, the complaint of the pain or the site of the pain which patient complains, that should be noted. If the patient complains of pain on the one side compared to the other, then that test is considered as a positive. So another test, that is test for the limb length. We have already discussed about the limb length measurement. So according to that limb length measurement that we have seen in the previous presentation, so you all can refer from that presentation, and based on that we'll check for the limb length. We'll compare on both the side. We'll check for the apparent and the that is the true limb length measurement, apparent limb length measurement, as well as in the true limb length measurement, we can measure for the segmental limb length. And based on that, if we find any alteration in the limb length, then we can proceed or we can do the treatment for the same. And if we find any apparent limb length measurement dysfunction or any apparent limb length discrepancy, then we can find out the cause. That is almost might be the related to the pelvic area, or might be it is related to the lumbar region. Okay, so that you all can refer from the previous presentation. So for the reference book, there's orthopedic physical assessment in the Maggie book, David J. Maggie. These all the tests are given in the detail, so you all can refer that book. Thank you.